So now we will try to understand by the figure or by the graph what is affect, what is range, and how it is shifted, what is the intensity. So in case of psychiatric disorder, we have four major type of affect on the basis of classified disorders in classificatory system. So one can have cheerful affect, second is anger irritability, third is sadness, and fourth one is fear and anxiety in case of anxiety disorders or otherwise presence of anxiety in other illnesses like schizophrenia and depression. Now look at the white circle, and on the circumference of white circle there are four lines for the four dimensions. This is the euthymic state. If we will consider the circle as a normal emotional reactivity, so one will show all of the emotions in equal amount at the point of time. If you will discuss or talk with the patient, having conversation with the patient shows the equal amount of fearfulness, cheerfulness, anger, irritability to the stimulus, and sadness to the stimulus. This means the patient is in euthymic state, and range is also within the average limit. So we will consider this circle as an average range of all the emotions in four dimensions. Now what happens in elated mood? You can see there is a red circle. Now the patient started showing less of anger, irritability, and less of sadness, less of fearfulness, and shows cheerfulness most of the time during the interview. And the intensity of elatedness or cheerfulness is surpassing the threshold of normal range. If you find such a situation, one can say the patient is in elated state of emotional expression. So range is increased. You can see the green double arrow. The range is gone upward from the circumference of the circle. It is more intense to the trivial matters or in the absence of external stimuli. This is the shifting towards anger irritability, and intensity is increased. If it is shifted towards anger irritability and uh, the circumferential line will be at the white circle, then intensity would be in the normal range, and shifting towards anger irritability will be there. So intensity is increased and shifting is done because other kind of emotions are not being expressed during the interview as much. Similarly, this is for sadness. You can see the shifting and increased intensity. In anxiety disorder, it is shifted towards fear and anxiety. So range is shifted and intensity is increased. What happens in restricted, constricted, shallow, or dull effect? More or less, these words are what you can say synonymous to each other. The restriction, constriction, shallowness, dullness defines the same thing more or less. You can see the patient shows emotions in all the directions, but the intensity is decreased. For the stimulus, the person is not showing that much of intense cheerfulness, that not much of anger irritability, that not much of sadness, and not much of fearfulness up to the normal range. So from all the directions, intensity is decreased, but there is no shifting towards any type of emotion. This is called as restricted affect or constricted or shallow or dull affect. What is flat affect? Flat affect, you can say it's a mask-like face. The constriction is so intense that it reduced to minimal facial expression or no emotions. No. This is a mask-like face. Mask cannot have emotional reactivity, so one can relate to that.